Hello, I'm again here back to you with a new topic. And before we could start the topic, I really thank for all the subscribers for the channel who have subscribed my channel. And I am expecting more from your side, like your views and your thoughts on what topic we could be discussed in the next session. So, hello connections, let us go to the topic. So, before going into the topic, I would like to give a short clue on what we are going to discuss today. Yes, the thing is that nowadays, not only nowadays, in olden days and on all the centuries, nurses are liable to many of the legal and ethical issues. So, in that, we are going to see a small part topic or a small part of it. So, I would like to give a clue where the nurses either forgot the treatment to give or might be giving a false treatment, like for example, giving medications, administering medications in the wrong site, in the wrong route, or might be not concentrating on the patient care, or might be in the discharge procedure, admission procedure, and so many. So, yes, today we are going to see a topic from management which is malpractice and negligence. So, coming to the introductory, I would like to coin a statement from the JACO, that is the Joint Commission of Accreditation of Healthcare Organization. So, this organization has given a very good sound or definition on what is malpractice. Yes, malpractice is the unethical conduct of psychomotor skill, mainly the professionals, especially the nurses. So, this is not only applied to the nurses but as well it is applied to all the healthcare worker. So, it concerns mainly with the professional action or might be failure of a person with professional education and skills and knowledges who is unable to act in a prudent manner. So, this is the small definition of malpractice. Next, we can see about the major factors which are involved in the malpractice. Yes, we can state with some examples for easier understanding. The first one is early discharge. So, early discharge in the sense it's not like the nurse who is discharging the patient at early. Might be the patient is being discharged even without treated properly, or might be even before the recovery of the patient due to the negligence of the nurse, the patient is being discharged, which causes the patient for readmission rates to the emergency room as well as readmission rates to the ICU, or might be readmission rates to the ward. And the second important topic or the second important factor in malpractice is that delegation. So, delegation is nothing but, we all know, equally giving the works and the autonomy and as well as the responsibility to the nurses. But if this delegation is being given to an untrained worker, will it be going to be satisfactory or will it going to be meet the needs? No, of course it's not. So, delegation of work to the untrained nurses is also the second malpractice. And the third malpractice is that shortage of nurses in hospital downsizing. Yes, I know, like you all will be thinking of what is hospital downsizing. Are we going to destroy the hospital or are we going to demolish the construction? No, not at all. The thing is that the nurses are not equal to the patient ratio. Might be, for example, in case of a ventilated patient, there must be the nurse ratio of 1:1. In case of a non-ventilated patient in an ICU, the nurse-patient ratio must be 1:2. And in case of all the general wards or deluxe wards, the care of the nurses to the patients will be 1:7. But if this ratio, standard ratio, is not being followed in the hospital, like might be giving a burden or a pile of patients to the nurses, might be one nurse taking care of 50 patients. Is it going to be practically sound? I don't think so. And the care, yes, the quality of care is also not going to get down. So yes, that is the third important shortage of nurses and hospital downsizing. And the fourth important point is that better informed consumers. Yes, you all may think, what is this man saying? Like, what better informed consumers? It's nothing but the search engines nowadays, which is readily available, which we call it as Google Doctor. Yes, Google Doctor, or otherwise, you can nowadays see that many people are just immediately they get the reports, or they are getting diagnosed. Immediately they take in the mobile and search what is that and how it can be prevented or how it can be dealt with and so on. For example, you can take diabetes itself. So once the patient is being diagnosed as type 2 diabetes mellitus in the early adulthood, immediately the early adulthood will move on to the preventive aspects to prevention of complication or restoring the blood sugars within the normal limits or restoring the HbA1c and so many. Like some of them would mostly practice herbal therapies or the other indigenous system of medicine. So, when the patients are very sound on their own diagnosis, and if the care is not being met by the nurses, or if it is going to be an inappropriate care, that can also be an exact malpractice. So, here the fourth point again I repeat is that better informed sources or better informed consumers, which is nothing but our patients. And next we can see about the fifth important point is that on malpractice is advances in technology. So this is like advances in the technology, which I mean is that the thing what is the equipments as well as the instruments which is being intended by the hospital. So we cannot stay on with the old practice itself, stating that yes, I am going to give the care which I studied in this year. No, we have to get updated and we have to upgrade ourselves in whatever equipments being intended in the hospital. It is not like you can't say like I didn't study in my syllabus, it was not taught me. No, it is like we the nurses have to create a culture that in future we will also be going on updating our knowledges. There is always a well-stated statement for the paramedics is that if you are not updating, you will be outdated. So that's the reason advances in technology, and if the nurse is unable to use that technology or refusing to learn that new technology, can also be another important malpractice. The sixth important point is that increased autonomy and responsibility. Increased autonomy and responsibility is that getting oneself updated on new policies and procedures or the protocols which the hospital is refined. For example, it can be a fall of patient in the hospital. So how are we going to prevent or how are we going to improve the fall of patient? Already all the standards are settled. Like for example, you have the Morse fall risk assessment tool to find out how the level of risk, whether the patient is at mild risk, moderate risk, or a very severe risk of fall. But what is the use of the tool in place? Just ticking the chart, not communicating with the patient, not seeing the patient indirectly, and you give some score randomly. So now again, this tool is now malpracticed. Instead, it can be done and policies and procedures. For example, if the patient is in mild fall risk, you can educate the attenders and you can educate the family members, and you can also educate the patient if the patient is conscious, and thereby we can prevent the fall. As well, if the patient is falling under the category of high universal fall risk, then immediately wear an ID tag and you can put a caution board on the foot end of the cot, and you can give during the handouts. You can always communicate with the other nurse who is going to give the handover and takeover, and through these channels that way we can prevent the fall risk. So that is that we have to have the total responsibility and total autonomy on updating ourselves on the new policies and procedures. And the seventh important point is that the seventh important point is expanded legal definitions of liability. Expanded legal definitions of liability is nothing but the person is always responsible. That is, I always say the person is nothing but the nurse is always responsible for their work if they are lacking during their care. Might be, for example, a nurse is being posted for in a pre-operative room, and if the pre-medications are being ordered according to the milligram, if she refuses to give, or if she forgets to give, or maybe if she misses to give, all that action, whatever action the nurse is taking, she is totally liable. Not only like administering medications, doing procedures, even a simple conversation to the patient. So before giving the drug, whether the health teaching on the drug was given. So all these simple tasks which is being not done by the patient is also another important malpractice. Next we can see about the next important point we can see is that these are the major, these are the 7 major points on malpractice. So, not wasting the time, I would like to move on to the negligence. So, what is negligence? So, actually, which leads to malpractice? I think negligence is the major cause which leads to malpractice. So, what is negligence? Yes, negligence is nothing but failure to do so, or failure to attempt it, failure to complete it, failure to do the accomplished task or the dedicated task. So let us see the failures one by one. What can be the first negligence is that to inform the patient the necessary material which is needed, as well as failure to inform to the physician on time. Might be the patient is being admitted at 8 o'clock, example, and you are going and just intimating the physician, might be at 10 o'clock or 12 o'clock. Is it a good sound of practice? No. We have wasted around a solid of 2 hours where the meticulous care can be given at the earliest. Or might be the patient came to the OPD, and the turnaround time, which is like universally might be 1.5 hours, and if we are going to delay and the patient came at 8 a.m. and if the physician is going to go and see by 8 p.m. due to our failure to give the intimation to the physician, again that's also failure to inform the physician within time. It can be the patient incomings, or it can be the patient's diagnosis, or the critical values, or might be the patient like going for deliberately ill and so on. And the second important point in failure to intimate the following would be like not responding to the client's actual problem. Might be the patient came with fever in the admission period, and on the second day the patient is developing might be dizziness, or nauseated, or might be wanted to throw up, or any other like for example simple pain. So if you are not going to listen to the patient, or you just neglect, because yes, he or she is a cancer patient, so she is going to have the pain. So why should I always ask the pain score and do the assessment and reassessment? Never ever do that. So what we have to do is that always respond to the client's actual problem. But here negligence play a major role, like not at all listening to the client's problem. Excuse me. Yeah. Not giving clear and detailed explanation on the procedure. So the clear and detailed explanation on the procedure is that might be the patient is posted for a surgery and you are not explaining the risk, benefits, and what can be the alternative therapy, and what are the follow-ups, what can be the possible complications, and if all these are not being educated, or not being conversated to the patient, and just blindly you go and say, okay, please sign in the consent form, is it going to be sound? No. Again, we are doing a great mistake over here. So not given clear and detailed explanation on the procedure. The next important content on negligence will be, the next is that failure to adapt quality nursing care. Quality nursing care is that might be to implement the planned nursing care, it is being deviated or devoid, or failure to adapt to the organization rules and regulations. Like for example, they tell you like you have to do the admission procedure according to the standard operating SOP, standard operating procedures and policies. If not followed, that is also going to be another negligence. That is, the quality of the nursing care won't be met, as well as not, or maybe you say failure to implement the doctor's order. So the doctor's order might be is given a PRN medication if necessary, or stat medications, or maybe positioning the patient, or transferring the patient to the diagnostic centers. So many orders which is given by the doctor, and if that particular order is not followed on the exact date and time, is also another negligence. The next important negligent issue would be failure to monitor and evaluate. So what to monitor and evaluate? That is, not completing the routine work during their shift. So during their shift, they what they do is that they just ignore, and might be the time is up and not completing the routine task, might be the vitals or hemodynamics, or checking a CVP, or might be reloading the drugs in the ICU, and so many. You can give so many examples of not meeting the routine work during their shift basis. And failure to apply the planned nursing care. So failure to apply the planned nursing care is that formulating the nursing diagnosis and giving the implementation, and whenever necessary doing the evaluation and re-evaluation, or you call it as the reassessment. And failure of not looking onto the prognosis of the patient. So here the prognosis of the patient is that we have to, being a nurse, we have to see how far the patient is prognosing, whether he is in a good prognosis or in a bad prognosis, and if he is in a bad prognosis, what can be done next to the patient. So always we, the nurses, should have the critical thinking on how the patient can be recovered, or how the patient can be prevented from infection, or how a client can be prevented from any other diseases. And then the next thing is that failure of the recognition of clinical symptoms. The patient might be not always coming and telling you that I am having dizziness, I am having nauseated. So you might be in the same ICU, and if you find a patient lying down without a pulse and respiration, and if you are not going to give any important majorly attention, or if you are not starting the CPR, that is also one of the important negligence in our nursing practice. The next important failure, you call it as the fourth important failure of negligence, is that failure to record. So what recording? It comprises from head to foot everything. Not recording the patient development during treatment. Might be you give a paracetamol for pain. So if you give it through oral, after 1 hour you have to reassess, then check the pain score, and you have to document. And if still the pain is there, more worsening, then you have to plan for alternatives. So if this particular thing is not being continued, that is also a failure to record. And failure to not recording the exact site of injury. Might be the patient came with an RTA, road traffic accident, and he is having an abrasion over the left elbow. And if we record it on the right elbow, that can be also a major negligence. Not performing initial and continuous nursing assessment. So immediately when the patient comes into the ward or ICU, within 10 minutes or 30 minutes, the turnaround time, you do the initial assessment of head to foot of the patient. And if your failure of doing the assessments very frequently, then that is also coming under negligence. Failure of not recording the details of the medical order stated by the physician, as well as failure of not recording telephonic communication by the doctors or physician by using the IS-bar tool. So IS-bar tool is like I have given in the background, just follow that. The next would be failure to client's advocate. So here like for the client or the patient who come to us are always like they are in a dilemma, like whether to do or not to do, or whether to proceed or not to proceed. So but here we are going to be an advocate, we are not giving the choices. Instead of that, we are giving the explanation of how it can be remedied, or how it can be done the most good way, or what are the positives and negatives we put forth on the front of the patient and tell them the choice is yours. So is there like clarifying the doubts whenever oral orders are given by the doctors, and if not done, might be that is also a negligence. Like for example, you get an oral order, the doctor is ordering dopamine. Instead of that sound alike drug, you go and start with dobutamine, dopa and dobu, sound alike drug. And if you're not having the read back technique or read back policy, again this is another negligence of malpractice. Not making sure that the patient has been placed on a safe environment. Might be you're too busy but you forgot to put the side rails for a high risk patient. Then might be he can fall down and create a head injury. So always we have to see that we are not harming the patient. The first and foremost which comes into us our mindset is that do no harm to the patient. Rather than you can sit or you can be very close to the patient instead of going and manipulating the patient more and more and creating more and more complications. The next important negligence, which is due to the failure of handle to equip with accountability, might be your hospital has given sophisticated equipments and all the instruments, but you are not maintaining the daily maintenance. Might be a defibrillator, so it should be checked, it should be put in power socket, and you have to see that it is not overcharged and so on. So if those protocols are given for one each equipment, it varies. So we have to follow that. If it is not maintained, that is also coming under negligence. Failure to not assess or evaluate the safety of that equipment before use. A new equipment comes into your hospital, don't immediately directly use onto the patient. Instead, use on the simulators. Check it whether it is all good in working condition. Then you proceed with the direct patient. And not showing interest to learn a new equipment. And we the might be the older nurses, especially the senior nurses, who are refusing to learn a new equipment or new instrument, that can be a major negligence. Failure of not using the equipment when needed in time, as well as failure of not getting the consent when escalation of treatment. Might be if the patient needs reintubate, you have to go and get the consent from the respective, what to say, seniors, especially the attenders or the family members. Without them, we cannot go and intubate. But that can be done in a very fast manner, and how we can explain what is the major benefits and risk, and you can intubate the patient and so on. Or maybe you do an ICD insertion or spinal tapping or any other thing. So whenever the escalation of treatment is planned, we have to get the consent from the patient if the patient is conscious, and from the attender if the patient is unconscious. The last important thing is that the next is negligence issues leading to malpractice can be prevented. So I would like to conclude my topic on this negligence and malpractice. Like if we the nurses are going to be very genuine or very committed, and as well as excellently dedicated, honest attitude, trustworthy, and effective communication towards the patient care, not giving our own opinion towards the nursing diagnosis or the clinical diagnosis which is made by the physician, not using any verbal abuse to other healthcare worker in front of the patient or patient attenders, and the last important point is that keeping confidential, yes, secrecy. Maintain the confidentiality on all the aspects of patient care, even the patient name. See that you give the care, but you are not going and explaining that he. Even in a case presentation, the patient face is being dull, as well as we are going to dim the, maybe we say Mr. X, Mrs. Y, or Mrs. X, and so on. See that you keep very confidential. So thereby we can be a good nurses in future. Thank you for your patient listening. See you out with a new topic. Ta-da! Don't forget to like, subscribe and comment. Thank you.